Yield 2 minutes to the author of the IPAB repeal, gentleman from Tennessee, Dr. Poe, for 2 minutes.
The gentleman from Tennessee is recognized for 2 minutes.
I thank the chairman for yielding, and I thank the chairman. I guess if the Affordable Care Act is so popular with the American people, that's why 60% want it overturned. I'll start by saying that. That's the latest that I've seen. Let me just go over briefly what the IPAB is and why I'm so vehemently opposed to it. As a over 30-year practicing physician, I've looked at this and I've seen two examples already of why I know and what I know is going to happen here. We have the model in the SGR, the sustainable growth rate, where we pay Medicare physicians today. It has been stated multiple times. We have a board with 15 appointed people to it, over half of whom cannot be healthcare providers or cannot be healthcare related folks that are going to make decisions based on a formula for Medicare spending. We're going to set limits. If you exceed those limits, then cuts will come to providers. We've done that with SGR, and guess what the Congress has had the ability to do during that time? To override those cuts, because everybody in here, both Republicans and Democrats, understand if we cut our providers, we're going to decrease access for those patients. So what's happened with SGR? Just 2 weeks ago, we passed an SGR temporary fix to the end of this year to avoid a 27% cut in physician payments. Guess what would happen with IPAB? A 27% cut, Mr. Chairman, to Medicare providers, and in 5 years, also the hospitals are included. And I can tell you our rural hospitals where I live will not survive those cuts. And those cuts will occur with minimal overlook from this U.S. Congress and no judicial review. And let me read this right here. IPAB is the single biggest yielding of power to an independent entity since the creation of the Federal Reserve. And this is not me. This is Peter Orszag, the former budget director for President Obama. So my concern as a practicing physician is if we cut physician payments so far that our patients will not have access to us. And right now, Mr. Chairman, in the primary care group I'm in, that access is already being limited, and we see it around the country. I yield back the balance of my time.
The time of the gentleman has expired. The gentleman from California.
I yield. He wasn't quite finished. Another minute to
The gentleman
Dr.
from
Rowe.
Tennessee is recognized for additional minute.
I thank the gentleman for yielding. And one final thing, as an obstetrician, I started practice in 1977, delivered almost 5,000 babies, paid $4,000 a year for malpractice coverage. When I left, the young physician replaced me $74,000 a year. The patients got no more value. 1975, when I got back home from the Army, every single malpractice carrier had left the state of Tennessee. All 10,000 or so, almost all 10,000 physicians in Tennessee get their insurance from a mutual company. Since 1975, over half the premium dollars that every doctor has paid in the state of Tennessee has gone to attorneys, not to the injured party. Less than 40 cents of every dollar has gone to the people who've actually been injured. We have a terrible system of paying people who have been injured, compensating them. And this will allow us to do that and will allow us to get some certainty so that those costs don't keep rising beyond anybody's ability to pay. And what's happened in a lot of places, Mr. Chairman, is access to OB doctors and high-risk doctors has been limited because of the liability. I strongly support H.R. 5 and encourage my colleagues to do the same, and I yield back the balance of my time.